What's up? It's 8:34, Thursday, August 19th. Sabrina Salas-Matanani, good morning.
Good morning. Let's go into the Zoom room where we have got the chair of the Physicians Advisory Group, Dr. Hoa Nguyen. Good morning, Doc.
What's going on,
Good
Doc?
morning. Morning.
So,
It have been busy.
Yeah.
Testing already morning, and there's long line everywhere at Tejan, at the clinic. I think that we really need to open more site for testing. Because people need to find out if they have the virus or not, and isolate themselves and stop the transmission of the virus. So I think that we're going to ask DPHS to open more site rather than just Tejan.
Right, yeah, because I was asking you before we went on, only 560 tests performed yesterday, and you're saying that's because people are lining up so long to get tested that they're just giving up. And the risk there is that these people could have the virus. They're going to go home and do whatever because they didn't get tested. And so you're calling for public health to open more testing sites.
Right, because only 400, right? If we're saying 560, only 400 are being offered over at Tejan.
Right.
So
Yeah,
it would
so
seem
we-
like, what, there's only 160
Yeah,
tests?
even at AMC, we test over 100 a day, on top of our patient care. So there's a huge burden for the tier 2 clinic to do testing. Because like I said, we have our own patient to take care of too. But yeah, every day now for the last week or so, we do over 100 tests a day.
Over 100.
So, with the Abbott machine, we can pretty much identify on the spot about 15, 20 minutes that they positive right away. But again, the parking lot is have no more space in the parking lot. It's so full. So I think we need to open at least 1 or 2 more sites everywhere so people can have access to this test like as soon as possible.
But with only 560 tests that were ran yesterday, which is inclusive, I believe, with private clinics, is there a need? I mean, I'm just trying to figure out if private clinics are packed, wouldn't those numbers be higher for the number of people being tested?
Yeah, the private clinic, Sabrina, they can only do so much. AMC Manila is built to do that, but other private clinics, it's almost impossible for people to go in and get tested because their schedule are full, with their own patient. And, they don't have the big parking lot for people to drive in and get tested and drive out. So it take a lot of manpower on the clinic to do that. So like I said, public health just need to put more sites. I think they can have one in Naganya, so people in Naganya can access it, one down south. So I think that several sites need to stand up as a mobile drive-through, just like Tejan for testing. We really have to do a lot more tests to try to identify the infected person as soon as possible, because some of the especially the fully vaccinated, they have very mild symptoms, but they can transmit the virus and they go around without knowing it. So the more tests we do, the better we can isolate the virus. So we need to stand up at the test site very soon.
Doc, I just got to follow up because I know that you had to come on Friday imploring the governor to implement restrictions immediately. We're just hearing from a variety of sources that adjustments are under consideration, but what's the deal when you have the head of your Physicians Advisory Group begging you to dial back and implement restrictions because of this Delta surge that we're now ending week 3 of? Doc, what gives?
Restriction had to be in there, and I guess she had to make the final decision, balancing when the right time to do it. But I think that the new EO should come out with quite a few more restrictions out there, and I'm pretty sure that I think it's come out tomorrow or Saturday. But yeah, restriction will be in place on some multiple things, in business and gathering, all that kind of stuff. But the the final numbers, she had to put that number out. So you guys gonna find that out pretty soon. But we have to somehow also ask our people to be very mindful, to go back to the basic, using your mask. And I keep asking every patient I see if you have any plan for any gathering to refrain from going at this point, because that's where the transmission of virus going on, is on the gathering. So if you have a function, a party, or whatever with a lot of people, we just have to ask you to play your part, and try to prevent transmission, because once this Delta get a grip on the community, it's very hard to shake. I tell you, it will be here, and it will be much deeper in our community if all of us don't play our own part.
Is it too late though, Doc? Because it kind of seems like this spread is it's pretty rampant, and we're going on 3 weeks with, we're talking 3 weeks and not like 10 cases. We're talking 3 weeks of 20, 30, 40, 100, 50, 38.
Yes, no, it's never too late, Chris, Sabrina, to make an effort on everyone to try to stop this. It's going to take us a while if everyone works together to make this number to go down. But we have to start from somewhere. So I think that we just have to ask people to do that, just so we can go downward. It will go up for how long before it's improved, and I'm pretty sure that the hospital admission is going to get worse before it gets better, just because the hospitalization is always lag behind about 2 weeks or so, a week to 2 weeks. So we might see the hospital going up in the census and the severity. What we're afraid of is that if we keep having double digit all the time, the young people from 18 to 40, they're going to bring it home to the elderly, and we will start seeing the high risk patient, the elderly, going to end up in the hospital, because you can be fully vaccinated, but if you expose the virus long enough, yes, you will catch it. And the elderly with their immune system and their comorbidity, they might not fare so well on the virus. So, like I said, we have to stop the gathering somehow. I know there's a lot of people planning for family gathering and some weddings, some party, but I tell you, we have to think about what to do with those planned gatherings, because all we need is one cluster, and it's impossible for us to change those cluster.
You mentioned this, and you're spot on. When we had you on, I think it was over a week ago, you said that just watch, those hospitalizations are going to go up. We're at 16 as of last night. 5 people are receiving ICU level of care. You say it's never too late, but is it too late?
No, it's never too late, Sabrina. We have to try. If not, we're going to get a much worse situation.
But isn't 16 pretty bad?
You said 10 was the trigger.
Yeah, 16 is bad, and ICU is bad, so we don't like to see those numbers. Remember, both hospitals are full to the max with non-COVID patients already, right? I mean, without COVID, both hospitals are full, so adding COVID, it's going to be a lot of complication in the hospital. So, so we have to be careful, because the healthcare system is going to tip pretty soon. I know the clinic side, on the private practice side, we just getting hammered on the sick visit. So, I'm going to ask all our provider and all the physician clinic in Guam, just please be careful. We do not need to have the front liner to be sick. Because we need every one of you guys.
Thank you, Doc. We got John Fernandez coming on. Obviously, there's been some spread in the schools, but I know you were texting me yesterday with some messaging that you wanted to get out to the parents before we get. Yeah, if we could get John on, let's go ahead and get John on, if you don't mind, John, and then we'll. Because I know Dr. Nguyen has to run.
But with the school, I'm really asking the parents. This is where we really need your help, parents. Is that if your kid cough and cold or congestion, they don't feel very good, please keep them at home. they not catching from the school. They are from home. And as our respect for other students and the staff and everyone else, your kid are sick, it's just a common cold. Get them, get them to a clinic, get them tested, and keep them home from school until you're cleared by a physician. But you don't want to bring this thing to the school. The only positive in the school that we have so far, because parents, we didn't do our job. So we really need to do our job by keeping your children at home if they feel sick. And if we do that, the school are very safe. It's not the school. It's us doing our part, a community, individually. Again, keep your children home if they feel sick and don't send them to school. That's all we're asking for.
Thank you, Doc.
Thank you.
All right.
Okay,
Thanks,
guys.
Doc.
Be
Both of
safe.
you. Right on.
Okay.
You too. Wash your hands.
Okay.
Okay.
Bye.
All right. Give me some. Hit me with that. Every time we interview with Dr. Hoa, I need to sanitize after. I don't know why. I just feel like I need to. Bree got the eucalyptus. What percent alcohol is that? It's like 90. That's like 112% alcohol with a little eucalyptus oil. Let's keep it going to the KUAM News Zoom Room. 8:45. Superintendent John.